weak pelvic floor.
Signs and symptoms.
Signs and symptoms.
Weakness. So urinary leakage is also a sign of weakness in the pelvic floor. This is not, by and large, always true, but I tend to see more stress incontinence. So leakage with coughing, sneezing, laughing, jumping with weakness rather than tightness. That's not always true, but more often than not, I see that in a weak pelvic floor. You can have fecal incontinence, which is where you have leakage of stool. You can have gas incontinence, where you have leakage of gas when you don't want to lose that. There can also be a feeling of weakness in the core as well. So anyone who's postpartum that's heard of a diastasis recti, there's like a little bit of separation of the abs. So if you have that going on and weakness in the core and the glutes, there's a decent chance that there's probably some weakness in the pelvic floor too. And then pelvic organ prolapse is probably the other big one. It's a sign of weakness. So that would be where you have either, depending on your anatomy and what's there and what's not there, either dissension of the uterus, the bladder, or even the rectum into the vaginal canal. And those symptoms would include a bulging that you might feel in the vaginal area. It can also, that can lead to pelvic pressure and discomfort, difficulty emptying your bladder or bowels, depending on what kind of prolapse.
Like if you got to stick your fingers in your vagina to empty your bowels.
Yes,
like that's a problem.
Yep. And if you're feeling that like bulging sensation and pressure down, then that's usually a sign of that as well.
And what causes that?
So I see it a lot in postmenopausal women. In that case, it could be decreased strength and elasticity of ligaments and tissues because of decreased estrogen in menopause. I also see it postpartum if you had a really traumatic delivery, so forceps assisted, vacuum assisted, really, really big baby, those kinds of things.
So what exercises we do to fix that?
Kegels is part of that. So pelvic floor strengthening itself, glute strengthening, core strengthening, hip strengthening. I do a ton about breathing and biomechanics because the way that you breathe and the way that you're doing stuff, how you're lifting, how you're bending, can put pressure on your pelvic floor. It can be ultimately the cause of the prolapse if you're doing that over and over again. But even if that's not the cause of your prolapse, it's definitely not going to help your symptoms. So that's a huge part of what I do also.